Hello everyone, this is SHARMIA. In this video, we are going to see about what is meant by inflammation and what are the mediators of inflammation. First of all, inflammation means any if place get injured means our inflammatory mediators will be released to attack them to prevent that infection and to kill them foreign bodies or microorganisms which entering there in that area. There will be redness, edema and pain. This is called inflammation. What the mediators of inflammation means? Mediators means they are a messenger which act on the blood vessels and inflammatory cells or other cells to contribute inflammatory response. To produce inflammatory response, some cells will act on the inflammatory cells and other cells and blood vessels to induce the inflammation. There are two types of inflammatory mediators. First one is cell-derived mediators and second one is plasma-derived mediators. First one, cellular mediators. These are some mediators are secreted from the cells secretory granules which includes histamine, serotonin, lysosomal enzymes. Their histamine's main source is mast cells, basophils, platelets. Serotonin main source is platelets. Lysosomal enzymes main sources neutrophils and macrophages. Next, newly synthesized are prostaglandin, leukotrienes, platelet activating factor, activation oxygen species, nitric oxide, cytokines. Prostaglandins, which is released from all leukocytes, platelets, and uh, endothelial cells. Leukotrienes also released from all leukocytes. Platelet activity factor is released from all leukocytes and endothelial cells. Activated oxygen species is released from all leukocytes. Nitric oxide is released from macrophages. Cytokines is released from lymphocytes, macrophages, and endoplasmic reticulum. Next one is factor 12, which is secreted from liver, Hodgman factor, which activate kinin system and coagulation, fibrolysis system. Next one, complementary activation, C3A, C5A, C3B, C5B, and 2,9. These are secreted from the liver. Liver is the major source for plasma-derived mediators. Cells-derived mediators are released from all cells are inflammatory cells. Next one is serotonin or 5-hydroxy tryptamine. First one is cell-derived mediators. There are 6 types. First one is pathocyanamines, which includes serotonin, histamine. Second one is arachidonic acid metabolites, cyclooxygenase. There are 2 pathways: cyclooxygenase pathway and lipoxygenase pathway. Next one is lysosomal components. Next, platelet activating factors, cytokines, which includes interleukins 1, TNF alpha, TNF beta, interferon gamma, chemokines. Its last one includes nitric oxide and oxygen metabolites. First one is vasoactive which includes histamine. Histamine is stored in the mast cells, basophils, and platelets, which is released by any agents like heat, cold, radiation, chemicals, interleukins, which can release the histamines. This will induce the release of the histamines. Histamines will cause vasodilation of the blood vessels. When the blood vessels dilated, the blood flow in that area will be get increased, so that the inflammatory area will become heat and reddish. And it can increase vasodilation means increase vascular permeability. Yes, which can cause it can also cause itching in that inflammatory area and pain in that inflammatory area. This is the role of the histamine. Next one is serotonin, which is also known as 5-hydroxytryptamine, which is present in the gastrointestinal tract, chromaffin cells, spleen, nervous system, mast cells, platelets. In that cells are the major source of the serotonin, which its action is similar to histamine, but it will not cause more vasodilation. Compared with the histamine, it causes less potent vasodilation and increased vascular permeability. Next one, arachidonic acid metabolites. There are two pathways. First, lipoxygenase and cyclooxygenase. Lipoxygenase, first cell membrane phospholipids will release phospholipids. With the help of phospholipids, it release the arachidonic acid, which can further release 5 with the help of 5 lipoxygenase, release 5-HPTC T, which release leukotriene A4. Leukotriene A4 will release leukotriene B4, and it causes chemotaxis. It release more inflammatory cells in that area, attack more inflammatory cells. Next, leukotriene C4, D4 and T4 will get released, which causes vasoconstriction. Vasoconstriction means blood vessels will get shrinked in the inflammatory area. Then bronchospasm, increased permeability. Next, in this 5-HPTE, with help of 12 lipoxygenase, it can release lipoxynate 4 and lipoxin B4, which further cause vasodilation. It has inhibit neutrophil chemotaxis and stimulate the monocyte adhesion. Arachidonic acid with the help of cyclooxygenase, which release the prostaglandin G2. Next, it release prostaglandin H2. Prostaglandin H2 further release with the help of further release prostacyclin PGI2, which causes vasodilation, inhibit the platelet aggregation. Then there thromboxane 2. Thromboxane 2 is released, which causes the vasoconstriction, promotes platelet aggregation. Next, prostaglandin H2 can also release prostaglandin D2, E2 and F2, which can further cause vasodilation and potentiate edema. Due to vasodilation, and there will be increased blood flow in that area. This increased blood flow will increase the pressure in the blood vessels, which can further cause leakage of the blood vessels. Due to the leakage, the blood will leak out into the surrounding cells, which will further cause the edema. Third one is lysosomal components. So, major source of this components is released from neutrophils and monocytes. They potentiate they are the potent mediators. They degrade the bacterial foreign bodies and extracellular components. Chemotaxis will attract many cells to that area. It can also release acid proteases, collagenase, elastase, plasminogen activator, etc. Next one is platelet activating factor. Platelet activating factor released from platelets, basophil, mast cells, neutrophils and macrophages, endothelial cells, etc. They cause the increased vascular permeability, and they can also cause vasoconstriction, vasodilation, bronchoconstriction, adhesion of leukocytes to endothelium, and chemotaxis, degranulation, etc. Next one, Cytokines means a group of, they are the small group of protein molecules with the potential biological activity. Their main function is uh, activate the stimulate the immune responses. Main cytokines are interleukins, interferon, tumor necrosis factor, chemokines, transforming growth factor beta, adipokines, leptin and adiponectin. Their major action is increase the adhesion of the leukocytes in the inflammatory areas. In the injured areas, they will increase the adhesion of leukocytes, and they also increase the synthesis of prostacyclin, which cause the vasodilation and anti-aggregator of platelets. It can also synthesis the platelet activity factor and thrombogenic effect on endothelial surface. Last one is nitric oxide and oxygen metabolites. They are called endothelium derived relaxing factor. They are mainly released from macrophages, endothelial cells, and neurons. Major action is vasodilation, antiplatelet activity agent, microbicidal agent. Hush O2, superactive oxygen species, superoxide, toxic nitric oxide. They are produced. These products produced by neutrophils and macrophages will cause endothelial cell damage, tissue damage, and increase the vascular permeability. They are the dangerous uh, uh, cell-derived mediators. These are the cell-derived mediators which are released from the cells. First one is vasoactive amines, arachidonic acid metabolites, lysosomal components, platelet activity factor, cytokines, nitric oxide. Last one is nitric oxide and oxygen metabolites. Next one is plasma derived mediators. This includes four. First one is kinase system, next clotting system, fibrinolytic system, complement system. First, kinase system. These are released from the liver. Factor 12 will release factor 12A for the cause prekallikrein activator. Then plasma prekallikrein. Prekallikrein will cause kininogen, convert kininogen to bradykinin. This is the plasma derived mediator. Their action is smooth muscles. They contract the smooth muscles, vasodilation, increase the vascular permeability, and increase pain in that area. Next one is clotting system. Clotting system include factor 12 will also like that only. Factor 12 will release factor 12A with the help of 11A and 7A platelet factor 3. They convert factor 10 to 10A. 5A and platelet factor 3 combine and convert the prothrombin to thrombin. Then fibrinogen is converted to fibrin with the help of thrombin. In this way only our clotting system works, and the final fibrin that clot is formed. Their major action is increasing the vascular permeability. Chemoattractors for leukocytes, they will attract more leukocytes, and coagulation. Next one is fibrinolytic system. Fibrinolytic system, they act like plasminogen activators with the help of activated protein P, convert plasminogen to plasmin. This plasmin will help in the conversion of fibrin to fibrin degraded product. Then only clot is, after the small period of time, the clot has to be removed. In this way only the clot is removed from our body. Their actions includes activation of the factor 12 to form prekallikrein activator, which stimulate the kinase system to generate bradykinin. Splits of complement C3 to form C3A, which is the permeability factor. It also degrades fibrin to fluid products. They increase the vascular permeability in that area. Last one is complement system. Complement system is an anaphylotoxins. Product of the complement system is anaphylotoxins C3A and C5A. Their potency, the C3A is more potent than C5A. C5A is more potent than C4A. Their action is to release the histamine from the mast cells and basophils. 3,5-A, which also acts as a chemotaxis for leukocytes. Their membrane membrane attack complex which cause the pores in the cells for invading the microbes. This is the complement system. That's all. In the plasma-derived mediators, we have seen the kinase system, clotting system, fibrinolytic system, complement system. These are the mediators of inflammation. What are the area we have covered means what is meant by inflammation we see. Next, mediators of inflammation. Two types, cell-derived mediators and plasma-derived mediators. Cellular means cell-released mediators. They are released from the cells, secretory granules, newly synthesized cells. They include histamine, serotonin, lysosomal enzymes, prostaglandin, leukotrienes, platelet activity, factor activity, oxygen species, nitric oxide, cytokines. Plasma-derived mediators, they are released from the liver, mainly H1 factor, factor 12, then complement activation. Factor 12, which include kinase system, coagulation, there C3A, C5A, C3B, C5B to cell-derived mediators, there are 7 vasoactamines, arachidonic acid metabolites in that 2, cyclooxygenase pathway, lipoxygenase pathway. Next, lysosomal components, platelet activity factor, cytokines, nitric oxide, and oxygen metabolites. Vasoactamines, we have seen the histamine, serotonin. Arachidonic acid, there are 2 pathways, lipoxygenase, oxygenase. Lysosomal major sources, neutrophils, monocytes. Platelet, they are released from platelet base of mast cells, neutrophils, macrophages, and endothelius. Cytokines, their major sources, interleukins, interferons, tuber necrosis factor, chemokines, transforming growth factor beta, adipokines, in that leptin and adiponectin. Next, nitric oxide and oxygen metabolites, which includes macrophages, endothelial. They are released from macrophages, endothelial neurons. Plasma-derived mediators, which includes 4: kinase system, clotting system, fibrinolytic system, complement system. In that only we include H1 factor, factor 12. End product will be clotting, fibrinolytic kinase system, which can activate the complement. Kinase system, the last product is bradykinin. This clotting system which form a fibrin clot from factor 12. They increase the vascular permeability, hemotaxis of leukocytes, anticoagulant activity. Fibrinolytic system means degradation of this fibrin to fibrin regarded products. they will cause the vascular permeability increase due to the fibrin product, split of the fibrin product. Next, last one is complement system. There only we have seen C3, AC5, AC4A, which release the histamine from mast cells and basophils, so, cause hemotactic for leukocytes, membrane attack. These are we have seen in for plasma derived mediators and cell derived mediators. These are the mediators of inflammation. We know that what is meant by inflammation, and we have learned about what are the mediators of inflammation, how that inflammatory cells release the inflammatory mediators. Thank you.